Good afternoon. I am Dr. Ihsan Yildiz, and I am part of a group of clinics that specialize in treating kidneys. Today I want to talk to you about kidney disease and examination after treatment. Kidney disease is a very well-known condition and all people have heard of it. In the whole world, people treat this disease, but it's very expensive and methodical with several stages. In this disease, there is one special condition. It starts asymptomatically, and it's hard to notice, and sick people do not know when they got sick and how it began till the last moment. In the end, everything may end catastrophically. So everyone has to be ready for this disease. You need to watch your health for it not to end in those circumstances. If people have even the smallest suspicions of this illness, according to their feelings, you must immediately go to treatment and not wait till the last moment. Typically, treatment may not be enough because kidney disease can bring infection in the body. For example, feeling unprovoked vomiting and acid reflexes could be signs of the disease. I want to say that these symptoms also exist. It is not always standard. Figuratively speaking, when we speak about kidney disease, symptoms that cover the whole body can warn about its presence. Always be ready, especially people who have problems with heart pressure or unprovoked acid reflexes. For these sorts of people, it would not hurt to go through a checkup to find out if the disease is present or not. Be in control of your body. If there is a discovery, the patient must prepare for a very hard treatment. Of course, only after a full examination of the client can treatment begin. There are many different chronic kidney disease. There are two ways of treatment. If it's a chronic kidney disease, there is a complicated approach to the treatment which is used. This is hemodialysis. In hemodialysis, there are two options. Firstly, the abdominal body peritoneal dialysis or hemodialysis, both used as the standard for renal replacement therapy. The second method is a kidney transplant and treatment of a kidney transplant. A kidney transplant is the best treatment for renal failure because the dialysis method is not as good as a kidney transplant. A person's health will suffer, and it isn't worth the economic cost. It is likely that there is a lot of waste, many risks and hazard of losing life. There are many reasons why doing a transplant that can solve all those issues and means you won't have to take the risks of a dialysis. Death through dialysis is 3 times more likely, especially performing a hemodialysis, creates a larger mortality risk. Simultaneously, kidney transplant shows mortality reaching far lower rates. In the recent times, kidney treatments use a rejection. It is the removal of the kidney using special medications. Let's say a chronic kidney disease appears and the person who needs a transplant will go through an assessment to identify the required steps to take in treatment. Naturally, the first step is to consult their doctor and be directed to the clinic where assessments for kidney treatments or transplants happen. In this clinic, there needs to be a compatibility check to the treatment. This is necessary for maximum positive outcome of treatment. After this step, the patient can go through the transplant if due process. There are 2 methods of transplanting kidneys. The first type is when the transplant is taken from a living person to the patient. The second type is removing the kidney from a recently healthy young dead person. The second variant is used more often. In many places in the world, including in this country, this is the far more common method. However, there is a limited supply to be capable of helping everyone. Because of this fact, in many cases, the transplant occurs from a living person. Otherwise, catching the moment to help everyone would be impossible. Heaps of people who are ill in the kidneys, their renal failure is treated through dialysis. We sorely lack dead subjects from whom kidney can be extracted from, and there isn't enough of them to perform the procedure on. This is why people go through riskier treatments the far more hazardous way. Our clinic MEDİCANA does immediate organ transplants, but unfortunately, we do not have enough material to go through with many surgeries. Though to say it is unfortunate means that privately and nationally most transplants happen using dead people. Many families of dying people do not agree to pass on their organs to the people who need them, even those whose brain had shut off. If all people gave permission for organ transplants post-mortem, then those issues wouldn't be as prevalent in the medical transplanting. So it's not possible to solve this problem in any other way. It becomes necessary to proceed with doing a kidney transplant from a living organism. How do kidney transplants ensure from living organism? What procedure is necessary for such operations? Let's say a person is having kidney issues and they begin to look in their proximity like familial relationships, their mother, father, brother, husband, sister, friends, relatives. If consent is secure from one of those people, a compatibility check will determine whether transplanting operation can be performed if there is a good result. How does the preparation for a transplant happen? In an organ transplant clinic, coordinators help the preparation process, provide the compatibility testing, blood tests, and anything that is required for transplantation. Subsequently, afterwards, the person who agreed to give a kidney goes through anatomical tests, such as an immunity test. In an anatomical sense, the organ also has to be compatible. Compatibility is crucial. Only after this, the transplantation can be administered. People that go through tests can then go to the surgery. After laparoscopic method surgery, we track and follow that person who gave the kidney, so they do not have any pain or any inconvenience of problems, so the person who gave the kidney can return to physical activity as soon as possible and restore their normal way of life, like their job and so forth. Typically, in the duration of 3 to 5 days, we try to totally restore the giver and check them out. After the muscular veins are reconnected to the kidney, the tracking of the kidney commences, so it begins to transform waste into urine. If the kidney starts to pass toxins as urine, this means it is a perfectly functional operative kidney. This is a magnificent result, and it's gratifying to admire to support the outcome. Following this, the connections of the urinary tract may begin, and so can all the final procedures of a kidney transplant. With this said, the transplant is successfully complete, and we move to the next step. In this step, you are to take medication. Although it begins before the surgery, there is also a post-surgery period of medication administration that is needed to protect the body from infections and strengthen the immune system. After the surgery, administration of drugs is an important step. In very rare cases, this can facilitate side effects in 1-2 out of 100 people, although in my personal practice I was never witness to it. These side effects do not count as serious because it's practically unheard of in modern medicine, so they do not pose a risk to the organism. After the surgery, there may be some vomit or acid reflux, but they will wear off. So that is why problems are not raised most of the time. The most important is the correct administration of medication, a timely use of the dose. After 3 to 5 days, all the apparatus are disconnected from the patient and he is sent home. and we control him for another week. If there are no problems with urination, then we control the dose of the medication. After this control, medication continues for another week. The patient is invited for another checkup, which is the normal methodology in our clinic. The first 3 months after the surgery, we summon the patient for a weekly checkup. Then, gradually, the administration of medicine is stopped, the checkups become less frequent if there are no more complications. This is how a complete kidney transplant looks like. Just like I said in the beginning, kidney disease appears out of sight of the patient. Everyone needs to be on alert. I want to mention that secondly, if humanity has this problem, everything needs to be as one. We are not allowed to move away or detach from one another, we must help each other in this situation. Do not alienate, and instead of allowing dead people's organs to be wasted underground, we should use them to help someone who needs it and give someone life even after your own death. To finalize this topic, I want to say that kidney disease is the very insidious disease, and it's very expensive treatment, especially a transplant, being extremely expensive. But despite this, a kidney transplant is a new life. A kidney transplant, compared to dialysis, is uncostly, because after it you can live a normal way of life. So to all people who have this problem, we recommend a transplant. Be in great health, and thank you for watching. Good luck, everyone.